Hi, Dr. Ramsey Choucair. I'm a board-certified plastic surgeon in Dallas, Texas, and today we're continuing our series on facelifts, which is a primary focus of my practice. One of the questions that we get is, well, how long will my facelift last? And that is a difficult question to answer with honesty and integrity because there's so many variables involved when it comes to how long a facelift will, quote, last. First of all, you have to determine what does it mean, how long will it last? Well, I like to say that a well-performed facelift, which includes doing the deep muscle and gently redraping the skin and leaving all the natural anatomic portions of the hair and the ears normal, is the first step. And then once you've done that, you've done pretty much everything you can do to make the face look as good as possible, as long as possible. That's what we tell our patients. And then there are the factors that determine really how long will the facelift last. Certainly if you're doing a mini facelift where someone just pulls the skin up, that's a different animal. We're talking about when we've done everything we know to do by experienced surgeons. Again, the deep muscle and gently redraping the skin. Well, how long will that last, doctor? Well, I usually look at them and say, based on your skin type, your anatomy, and what we had to do, because some people have more fat in their neck than others. Some people have no fat in their neck and very thin muscles that are noticeable. Some people have a large jowl and some don't. Depending on many factors, I try and come up with a number that at least answers their question, but the caveat is, we really don't know. And any surgeon who looks a patient in the eye and says it's going to last you 20 years, no question about it, well, that's just simply not true. There's no way anybody can predict that. So what do we say? Well, based on their anatomy and their skin type, we like to say a facelift that's done well and with all the parts that we're discussing will hopefully last between 10 and 15 years. Where did I come up with that? Well, I didn't exactly pull it out of thin air, but close, because no one knows. So what's the real answer? The real answer is this. A facelift is something that would be done again when two things happen. One, a patient sees enough change in the aging process after the facelift that they don't like the way it looks. It bothers them. Well, that could be very soon, but it doesn't mean realistically anything could be done. So the second part of the when is a facelift ready to be done again is when a surgeon with a lot of experience looks at the patient's face and the patient doesn't like what they see, and the surgeon says we can make enough difference by doing another procedure, whether it's a full facelift or not, to create an improvement that meets that patient's expectations. Now that's a lengthy, kind of long answer, but that's really the truth about how long a facelift lasts. It's when the patient sees enough change after the facelift and a surgeon sees a change he can probably improve with a reasonable degree, and then the expectations of both are met. That's usually many years down the line. Now, will someone come in after 6 months and say, well, I thought the skin was going to be tighter in the neck? That happens all the time. But what happens is an experienced surgeon needs to let the patient know that even though they can pull the skin, there's no tangible benefit by redoing a facelift. And that's where the give and take and the trust with the surgeon and where the preoperative exam, the preoperative consultation with the patient before you've ever done surgery is where all the expectations are met. So again, it's a flimsy answer that I just gave you about when does a facelift need to be done again. But the answer is there is no real strong answer. But again, to give you a number, yeah, we tell patients 10 to 15 years and we adjust it based on their anatomy. So I hope that helps you a little bit.